I'm Lila Lazarus. The number of measles cases reported is now at a 25-year high. A disease we had all but eliminated is now right back at our doorstep. So what's the danger? What can be done? What are your questions? We have an infectious disease expert, Dr. Anu Malani from St. Joseph Mercy Health System. Thank you for being with us.
Thanks for having me.
When you hear that we are at a 25-year high, what does that mean to you as an infectious disease doctor?
I think it's very concerning. Measles is a serious disease. The vaccine is very safe and effective. It's concerning because of low vaccination rates.
Now you have the latest information. Where are we at right now in terms of the measles outbreak?
Well, earlier today, I think the CDC released new numbers, and we're over 800 cases. 800 cases in 23 states, including several outbreaks across states, including our own in Michigan.
So just when we thought things were leveling off, and they might be, you're telling us there's actually bad news out there.
Yeah, I think it's a matter of time. The outbreak is likely going to continue, possibly even worsen. I think we had 75 new cases in the last week.
We want to make sure everybody understands. We want to hear your comments. The doctor is willing to take your questions, and people are so misinformed when it comes to measles. And what is it, the biggest piece of misinformation you really want to make clear?
I think it's that vaccines are not safe. The measles vaccine is a very safe and effective vaccine. One dose is 93% effective in preventing the disease. 2 doses are 97% effective. There are really no side effects of the measles vaccine. So again, it's a very safe and effective vaccine.
For many parents, it's the most difficult decision. Should I vaccinate my child? What do you say?
Well, I think that there's lots of science that shows that the vaccines are safe, and if the vaccination rates drop, then this is we're at risk of having an outbreak, at risk of having an epidemic. That's quite concerning.
Growing up, we all got our vaccines, and we eliminated so many diseases. Talk about what we've been successful at in terms of eliminating.
Well, so a perfect example of that is smallpox. This was actually a disease that was eliminated in 1980, eliminated from the world. Previous to the vaccines for smallpox, we would actually see smallpox wipe out whole communities, and that's a disease that has been completely eliminated.
And we thought we were there, at least in this country, with measles.
Yeah, measles was eliminated in the year 2000, but since that time we've seen cases sporadically go up and down, but this year, when you look at the last 20 years, has been the year that we've seen the most amount of cases. And that's given a few big reasons. One is because there's low vaccination rates, and then there's also a lot of international travel, and there's international travel to places that actually have measles outbreaks ongoing.
And in those places that measles outbreaks are still ongoing, I know that in the year 2017, there were 110,000 deaths around the world due to measles, mostly in children under 5 years old. If you were to multiply that, maybe in the last 30 years, someone is asking, how many deaths do you think in the last 30 years?
Well, I know that in the last 15 to 20 years, we can say that there was 20 million deaths that were prevented given the measles vaccine. We know that young children are most likely to have complications. They can develop pneumonia, they can develop hearing loss, and they can actually, unfortunately, develop brain swelling called encephalitis.
So we just started really hearing about this measles outbreak in the last few months. What is it that constitutes an outbreak?
Typically, we think about 3 or more cases in a region. In Michigan here, we've had 43 cases, but there's several ongoing state outbreaks, including New York, Washington, New Jersey.
And because the anti-vaccine voice has gotten so loud, what is it that frustrates you, knowing what you know about these infectious diseases? What is the misinformation that you'd like to clarify?
Well, I think it's that vaccines are not safe. Actually, vaccines are very safe. It takes a long time for a vaccine to come to the market, to come to development. It takes years and years. They're well studied. Usually you have thousands of volunteers that are monitored. And then even after a vaccine comes and is approved, it's monitored by organizations such as the FDA. There's a vaccine adverse event group. There are different medical societies that are looking at vaccines. So these agencies are really there for us. They're to protect patients and protect loved ones from having adverse side effects from the vaccines.
It's so interesting, the comments that people, please continue your comments below. Pam says she was vaccinated and still got the measles.
Yeah, so the measles vaccine is very safe and it's effective, but that doesn't mean that it's 100% effective in terms of reducing the risk of measles. One dose is 93%, two doses are 97%. That doesn't mean that the risk is zero, but the risk is significantly lower.
And when we talk about protecting the herd, it isn't so much about just protecting Pam from getting sick. It's also protecting those who, well, explain it.
Yeah, I'm glad you bring that up because that's an important thing to discuss about vaccines. It's not just about us getting vaccines, but it's making sure that the community gets vaccinated, at least those that can get vaccinated. So vaccines will prevent illness in ourselves, but there are those, in terms of measles, there are those that actually can't get the vaccine. They're very young, children less than 12 months, those with weakened immune systems, pregnant women. So the vaccine and herd immunity works when everyone is getting that vaccine. So that makes it harder for measles or another virus to be transmitted across the community because there's no reservoir when people actually are vaccinated. People are protected from developing it.
So a lot of people ask this question, and Jim's asking now on Facebook Live, had his shot, does he need a booster?
So it depends. Most adults, one dose is usually good enough. It depends if you're going to have international travel or go to a place that measles may be endemic, or if you work in the healthcare environment, or if you work in a post-secondary educational environment. For most cases, one dose for an adult is okay.
You mentioned travel, so let's get right to that. We have the summer season coming up. People will be traveling, let's say, more to Europe. Will they be bringing more cases back? Should they be getting a booster before they go to France or Italy?
Again, I think it depends. There are certain countries where measles is likely endemic, and that can actually be looked at. The CDC has a great website about what's going on in the world and in different places. So it sort of depends. Keep in mind that one dose for most adults is very effective and 93% effective. And most adults have actually received one dose.
So you talk about it depends where they're going, but even just on the airplane, the measles is one of the most contagious pathogens, right? I mean,
It is, and 9 out of 10 folks that are not vaccinated or that don't have immunity to measles can actually contract the disease. So it's actually one of the most contagious infectious diseases.
And if you or I had it and we sneezed right now, it would remain in this room for 2 hours?
Yes, it can remain in the airspace for about 2 hours.
So tell me how it's passed, usually one person to the next.
Yeah, so it's passed through close contact and it's passed through the air. And so when someone coughs or sneezes, that's how it can be passed. And
how does it present? So most people usually, I think, would think it's just a cold or the flu.
Right. So measles is typical of these viral illnesses. It is a lot like the flu. It has fevers, you have a cough, you have nasal congestion. One difference is most patients will get a rash that actually starts at the hairline, spreads all the way down. That's typically 4 days after you have the fevers and the cough. Usually spares the hands and the soles of the feet, but it's usually a whole body rash.
And are you saying it's contagious then 4 days before and 4 days after you get this rash?
Yep. It's usually contagious 4 days before, 4 days after, and if you've been exposed to someone with measles, it may actually take up to 3 weeks to develop measles.
And I want you to talk a little bit about the severity, because I've heard from people who are anti-vaccine that, you know what, it's not that big deal, measles. I'd rather risk getting it than have a risk getting a vaccine.
Yeah, so measles can actually be very serious.
Even deadly.
It's a serious disease. We know that 1 in 4 will usually get hospitalized. We also know that it can cause diarrhea, it can cause pneumonia, it can cause ear infections. Unfortunately, people can develop encephalitis or brain swelling. and people can have permanent brain damage, and usually one or two people that 1 or 2 in 1,000 unfortunately will likely die from measles.
So another question is coming up, and that's for daycare centers and how to protect the children from the other children who aren't getting vaccinated.
Again, so that speaks to the benefit of herd immunity or community immunity, where really we want all the kids to try to get vaccinated. There are some that may not be able to get vaccinated if they have a weakened immune system, but all the more reason that everyone should get a vaccine.
Who is at the highest risk?
So it's the very young, typically infants less than 12 months, those with weakened immune systems, and pregnant women.
And are the symptoms any different if I'm an infant or a senior citizen?
So if you're a senior citizen, you likely have immunity. If you're presumptive immunity is the way we think about that is if you were born before 1957, so at a time where measles was really endemic in this country, you have immunity. But we really do worry about the very young, and they're often too young to get the vaccine, and they're at risk for serious complications.
And I know you've started to answer this already once, but David is asking how a person gets the virus.
So they have to be exposed to the virus. So the general risk in going in the public is very low. There are certain communities that have low vaccination rates that we've actually seen a lot of spread. So you have to have exposure. So in the general public, it's low, but if you have measles develop in the schools or develop in the communities, and there's a chance for sort of close quarters, there's definitely a risk of transmission.
Throughout all of this, these last few months, as you hear these stories develop and you hear it spread from New York to Michigan to Washington State, what's been your biggest frustration?
Well, I think with measles in particular is that we have a very safe and effective vaccine. As we already talked about, measles can be a very serious and deadly disease that's can be associated with really serious complications. I think what's frustrating is that this really is an infection, a disease that is preventable.
So the main message, of course, is if you have not been vaccinated, get vaccinated.
Absolutely.
Your children should be vaccinated.
Absolutely.
And if you have questions, not only can you comment below, but you can talk to your doctor. And if you need to connect to a doctor, you can always call St. Joe, 1-800-231-2211. Talk to your doctor about your vaccine history, right? What if you don't know your vaccine history?
So in Michigan, there is a registry for kids and children. So we actually have a very good sense of those that are younger, whether or not they've had vaccine. We've seen folks that are a little bit older that are out of childhood. Generally, parents may have a good sense whether they got vaccines. I guess if you're not sure and you don't know, we can always give you a vaccine.
And I know people think, oh, this is, we're just creating fear by talking about measles. But again, it's a disease that we had all but eradicated. It's now resurfaced. A study did come out Friday talking about which cities are more likely to see more measles. And in the entire country, Wayne County came in at number 11. And I guess they're talking about the proximity to airports and the number of people who have not been vaccinated. Why is that so important?
Well, I think it's important to recognize where measles may come, but also where measles may actually survive and be transmitted. So if you look at the cities that are listed in that study, we're talking about Chicago, talking about Miami, we're also talking about Metro Detroit. So it's based on a few things. One, it's proximity to an international airport. So again, we talked about international travel being important, but it's also based on exemptions that are in place for people that don't want the vaccine, whether it's religious or philosophical exemptions. And so again, back to vaccination rates, where maybe the vaccination rates aren't as high as where they should be.
There are still people who believe this vaccine will lead to illnesses in their children, not health. What do you say?
Well, this is a vaccine that is well studied, that has been around for many years. We know it's very safe, it's very effective, it does not cause autism, and we have the science really to show that.
And actually, the person who made the claim that the vaccine causes autism lost his medical license.
Actually, he did lose his medical license. It was a paper. It was a paper that was initially published from England, and actually the journal had retracted that study. And you're right. Actually, the author did lose his license.
And of course, the damage has been done because the word got out and people started to believe things that weren't true.
And unfortunately, this led to many people actually developing measles and actually dying from measles.
So a lot of people ask if they should have that revaccination, that booster shot. Lynn is asking, if she was born in 1962, do you need to revaccinate?
So I think it depends. It depends on where you work, what your other risk factors are. It's important to recognize that when we all get vaccine, the community does better because there are certain groups of people that actually can't get vaccine. We talked about the very young. We also talked about those with weakened immune systems. So if we actually get the vaccine, we're also helping lower the risk for anyone else. So if you're born in 1962, there was a few years in the early 60s, there was a couple different types of vaccines, so it sort of depends on what vaccine you got, but I think maybe the best answer for that is just go ahead and get one vaccine. When you also look at the cost of whether you should check antibody levels to see whether or not you actually have immunity to the measles,
Might as well just.
you might as well just give the dose.
So it's all about prevention and protection. And by telling people you should get vaccinated, it's not just to protect you, it's to protect also those with weakened immune systems and babies as well. David is asking, is a good diet and rest important for a strong immune system?
Absolutely.
Will it protect you from measles?
It won't protect you from measles, but it'll do other things for your health.
So definitely you want to get a good night's sleep.
Absolutely. Yeah, I think you want to eat well, you want to exercise, you want to get good rest, but those unfortunately won't prevent you from getting measles.
And reduce your stress, right?
Yes, yes.
So what are physicians now telling the population? What is the word that we need to get out?
Well, I think it's what we're talking about is really that vaccines are safe, they're effective. In this case, we're talking about measles. If we can make sure that we have high vaccination rates, this is an outbreak that we are not going to see. It's an epidemic that hopefully will not come back.
Tell me some stories that you've seen.
Yeah, I mean, I think there's concern. Last year, we had a case of measles in our community at one of our hospitals, and this was a young 20-something-year-old person that went to India, and India is a country where you do see measles, and unfortunately, this young lady actually had not received their measles vaccinations, and then they came, and it was. Because it's a disease that we also have not seen in many years, it wasn't recognized initially. And because it's highly contagious and highly transmissible, there are certain steps that you need to take in the healthcare environment to lower that risk. But when it's not recognized, there is risk to others, there's risk to other patients. Fortunately, the patient did very well, and there was no secondary transmission, but I think we got lucky there.
So one of the things that's so interesting, because we nearly eradicated measles in this country, we have a whole generation of medical professionals who've never seen it, never had to diagnose it, and don't necessarily recognize measles when it comes in the office.
I think that's true, that there is a number of physicians and providers that have not yet seen measles, but there's enough information, there's enough education, we're talking about it, there's enough stories about it, there's enough concern about it that many have read about it, have seen what it behaves like. It behaves like many of the other viral illnesses that we see. I mean, I think there's a lot more recognition that this is around and this can happen. And frankly, we're asking those questions. Have you been exposed to someone with measles? Have you had international travel? What are the status of your vaccine? So I think there's been a lot of good, if you look at the positive aspects of sort of talking about this and sort of thinking about how we best protect our community.
But of course, one of the men that documented cases that came to Michigan, they thought it was bronchitis.
I mean, you're right, but with that, and with seeing all the cases and all the secondary cases and all the widespread activity across the United States and multiple states, I think that we're slowly getting there.
Let's get to this question from Jeremy. In 1981, when I was younger, my parents got me vaccinated. Then in high school, I had it updated. 1999, would I be on the registry?
1999, you may be if those were in Michigan. And I think the easiest way to answer that would be to have your doctor look in the registry. It's called Michigan Care Immunization MICR Registry. And so I think that would be an easy lookup that your provider could do.
Now, if you're over 62 years old, you're kind of given...
So I'm doing the math. So 43 plus 19, yeah, 62. Born before 57. We generally consider people that were born 57 immune
because they were exposed.
They were exposed.
At that time, measles was everywhere.
Measles was endemic, right?
And we were so successful in cleaning it up, and now not. So I want you to give it straight to people. Are vaccines safe?
Vaccines are safe. They're effective, especially in regards to measles. For a vaccine to come and be about and to be given to patients, it takes many years. And there's many different steps that need to take place. They're well studied with thousands of volunteers, and side effects, adverse effects are closely looked at. And then even after a vaccine comes, these are closely monitored by the FDA, the vaccine adverse event groups. So yes, the vaccine is very safe.
And one of the most stringently tested
absolutely,
of all.
Absolutely. If you look at sort of the gifts to sort of modern health, vaccine development and promotion of vaccines is, besides water safety and sort of waste disposal, I mean, that's one of the biggest advances in public health.
Dr. Anu Milani from St. Joseph Mercy Health System. Somebody's asking, what is in the measles vaccine?
So the measles vaccine actually has 3 different viruses. It has measles, mumps, and rubella. You actually cannot get the measles vaccine by itself.
Why is that?
Well, what you found over the years is that there are certain viruses that can actually be given together, and that they work well together. And because as the science has evolved and the engineering of vaccines have evolved, and as we've become more educated, we're actually giving more vaccines. We've had more development, but the ability to give some of these vaccines together also reduces the number of shots, and they actually work well together. So within the measles vaccine, there's the measles, there's the mumps, and the rubella vaccine. And traditionally, that's given for children 12 to 15 months, and the second dose is given for children 4 to 6 years of age.
When someone comes to you with a beautiful, healthy child and says, "I'm not vaccinating," what do you say?
Well, I think that's it's important to understand why they don't want to vaccinate. Do they feel that they are providing maybe more immunity for their child? Do they think that it would be better for them to naturally develop this, or do they think that the vaccine is not safe, or are there other reasons why? I think it's important to find out what those reasons are, but I also think it's important to really illustrate that vaccines are really safe, are effective, especially in regards to measles. We talked about the data that 1 dose is 93% effective, 2 doses are 97% effective, but vaccines don't work if we're just vaccinating ourselves. You actually need the whole community to be vaccinated, and that allows an environment where measles can't be transmitted. And that's when we talk about, in some cases, even elimination of diseases such as smallpox.
And have you seen people sort of get rid of the fear and say, "Okay, I'm going to do it"?
Yeah, I think you have to understand why, and we have to try to address those questions. And I mean, we can try to address those questions by what's out there from the science, what's out there, in terms of the evidence. And yeah, I think when people understand that and they see that. That this is going to help the community, that this is going to prevent illness in other folks as well, not just me and not just my child, I think people can respond to that.
You're listening to Dr. Anu Milani from St. Joseph Mercy Health System, and I hope he's convincing you this isn't just about protecting us, it's about protecting the community as a whole, especially those who aren't able to get the virus. Talk to your doctor about getting vaccinated. If you need to connect to a doctor, if you'd like to connect to a St. Joe doctor, the number to call is 800-231-2211, and we can get you a doctor who can give you all the information you need about vaccines. Colleen is asking, isn't measles something that just runs its course? If I've already had the measles, am I now vaccinated for life?
Well, if you've had measles, then you are protected. But you know, one reason to get the vaccine, not for all, you know, we've already talked about a number of reasons, but measles is a serious disease and it's associated with serious complications. 1 in 4 will become hospitalized. You know, children can develop brain swelling, encephalitis.
And there's no real treatment. Once you get measles, there's no real treatment.
There's no real treatment. So by not getting the vaccine in something that is preventable, you're putting yourself at risk or your child at risk for actually having serious complications.
And so in babies, when a baby dies from the measles, is it usually the encephalitis, the swelling of the brain?
The most common reason why little ones have complications from measles is due to pneumonia, and that's due to bacterial pneumonia.
Got it. And then once they're in the hospital,
Yep.
then they're putting many more people at risk.
Right. Well, and also once you're in the hospital, there's unfortunately other things that can develop due to illness, and ideally we'd like to try to keep everyone out of the hospital if we can.
Let's get back to vaccines in general and how they've changed the world.
Mm-hmm.
Because I think while people have been talking so much about their fear of vaccines, we're forgetting what vaccines have done for us in terms of polio.
Well, I think measles is a perfect example. If you look at you know, data from the World Health Organization and you look at preventable deaths, and we'll take measles since we're talking about measles. If you look at the last 15 to 20 years, I think the figures are 20 million deaths have been prevented from the measles vaccine.
Wow.
And so even in this country, you know, if you look at sort of previous data, we used to see 48,000 people hospitalized every year, 500 deaths, you know, hundreds of thousands of cases of measles. And essentially, you know, in the early and mid 2000s, you were talking about less than 50 cases of measles a year in the U.S. That's as much as we had in the state of Michigan this year. I'm
going for a personal question, but why did you become an infectious disease doctor?
Well, I think it's very challenging, very interesting. There's always something. You know, bacteria and viruses, you know, they really don't have a political agenda. I mean, they can infect anybody, and it really you realize how small the world is when you start talking about whether it's Ebola or other things that we've seen across this country through globalization. I think when you think about sort of global health, infectious diseases remains really the number one, you know, one of the top, unfortunately, one of the top killers in sort of in life. So I think that there is, it's stimulating, it's challenging, but there's also a lot of opportunity to make the lives of those better. Thank you for being on the front line. I think when we fear these kinds of things, viruses are our biggest enemy, and vaccines can be our biggest friend, right? Absolutely. So I need to remind people again, get vaccinated, talk to your doctor, or get a doctor. Connect with a St. Joe doc, 800-231-2211. What is your message, not just about the measles vaccine, but vaccines in general, and what vaccines do people want to be sure they have? Yeah, so I think the best advice would be that children, parents, you really should follow routine childhood vaccinations as recommended by the American Academy of Pediatrics and the CDC, and your pediatrician should be able to go over all those vaccines. But even adults need to get recommended vaccines, and you can talk to your doctor about those. Dr. Anu Milani, thank you so much. We're so glad that you tuned in. Thank you for being here. Talk to your family members about vaccinations. You're protecting not just us, but everybody else in our community as well. And we want to go back to the days when measles was not an issue. Thank you. Thank you.